You just found out you're pregnant, but now you're feeling cramps, and your mind is racing. Is this really normal? Is your baby okay? Or is something wrong? It's completely understandable to feel anxious. Pregnancy brings so many changes, and every new sensation can feel unfamiliar and a little bit scary. Let's take a deep breath together. In the next few minutes, we'll explore what early pregnancy cramps mean, when you can relax, and when you should reach out to your doctor for extra care. Let's start by understanding why cramps happen in early pregnancy. Mild cramping in the first trimester is much more common than you might think. In fact, your body is working incredibly hard behind the scenes. The uterus, which has been about the size of a small pear, is beginning to expand to make room for a growing embryo. It's stretching, thickening, and getting ready to nurture new life. The ligaments and muscles surrounding your uterus are also adjusting. They're stretching and loosening, making way for growth. Sometimes, this can create sensations that feel like pulling, tightening, or mild pressure. Hormonal changes play a big role as well. In early pregnancy, your body produces more progesterone. This hormone helps relax your muscles, including those in your pelvic area. While this relaxation is important for supporting your growing baby, it can also cause sensations that may be new to you, sometimes described as mild twinges, fullness, or gentle aches. Increased blood flow to your pelvic region is another factor. As more blood rushes to support your pregnancy, you may notice a feeling of fullness or mild discomfort, especially in your lower abdomen or lower back. These changes are a natural part of pregnancy and, for most women, are nothing to worry about. So, what do normal early pregnancy cramps feel like? For many, they're similar to the cramps you might feel before or during your period, but they tend to be milder. They usually last for a short time, just a few minutes to a couple of hours, and often go away if you rest, drink some water, or gently stretch. You might notice these sensations more when you've been on your feet all day, or if you've been sitting in one position for too long. Normal cramps in early pregnancy are not usually accompanied by heavy bleeding or severe pain. The discomfort is typically manageable and may even improve if you lie down, take a warm, not hot, bath, or change your position. Many women experience these mild cramps between weeks 4 and 12 of pregnancy, and they can be a completely healthy sign that your body is adjusting and preparing for the months ahead. But it's important to know when cramping might be a sign of something more serious. While mild cramps are common, there are certain warning signs that mean you should contact your healthcare provider right away. If you experience intense, sharp, or worsening pain that doesn't go away, this may be a sign that something isn't right. If your cramps are accompanied by heavy vaginal bleeding, or you pass blood clots, it's important to seek medical attention as soon as possible. Pain that is felt on just one side of your lower abdomen, especially if it's severe, could indicate an ectopic pregnancy, a rare but serious condition where the embryo implants outside the uterus. Other warning signs include fever, chills, feeling faint or dizzy, or experiencing pain in your shoulder. These symptoms could point to conditions like ectopic pregnancy, miscarriage, or infection, all of which require urgent care. So, what can you do if your cramps are mild and there are no warning signs? There are some simple, gentle ways to support your body and find relief. First, make sure you're staying hydrated. Dehydration can trigger uterine contractions, so sipping water throughout the day can help ease discomfort. Gentle stretching, like cat-cow pose or pelvic tilts, can release built-up tension in your lower body. Taking a warm, not hot bath can also relax your muscles and provide soothing comfort. Sometimes, simply changing your position can make a difference. If you've been sitting for a long time, try taking a short walk or lying down with a pillow under your knees. Prenatal massage, when performed by a trained therapist who specializes in pregnancy care, can also help you feel more comfortable. It's important to avoid certain things, though. Very hot baths, heating pads placed directly on your abdomen for long periods, or taking medications without your doctor's approval are not recommended in early pregnancy. Gentle, supportive care is best. Let's take a moment to clear up a few myths and misunderstandings about early pregnancy cramps. One common myth is that any cramp in early pregnancy means you're miscarrying. The truth is, most cramps are harmless, and miscarriage is just one of many possibilities. Knowing the warning signs is key to protecting your health and your baby's well-being. Another myth is that cramping only happens if something is wrong. In reality, many women experience mild cramping as their body goes through normal changes. It doesn't mean you did anything wrong or that there's a problem. Sometimes it's just your body working as it should. Some people believe you shouldn't move or exercise if you feel cramps. In fact, gentle movement often helps relieve mild discomfort, as long as you're not pushing yourself beyond your comfort level. Simple walks, stretching, and prenatal yoga can all support your changing body. Remember, when in doubt, call your doctor. Even if you're not sure whether your cramps are normal, it's always better to be safe and seek professional advice. Every woman's body is unique, and your doctor can run simple checks to confirm everything is okay. Never ignore symptoms just because someone else told you it was normal. Your situation may be different, and it's important to advocate for your own health. In summary, early pregnancy cramps can be normal, a sign your body is preparing for the months ahead. But they can also be a red flag if they're intense, persistent, or paired with other symptoms like heavy bleeding or severe pain. Listen to your body, keep track of your symptoms, and don't hesitate to reach out to your healthcare provider if you have any concerns. If you found this information helpful, please consider liking, subscribing, and sharing with other moms-to-be. Your support helps us continue to bring you more trusted health tips and wellness guidance. Take care of yourself, and remember, we're here every step of the way.